About 2/3 of Americans, of our community members, of our neighbors, of our family, of our friends, are impacted by substance use in some way.
There are people with substance use that live in your community. You may say, well, not in my neighborhood. They're in your neighborhood.
Over 1 million people in Los Angeles County are struggling with substance use disorder.
In a world where overdose and substance use has become a public health crisis, accessibility saves lives.
How do we give them an easy way, a simple way to connect with the services that they actually need?
And that's what the Service and Bed Availability tool does. It increases access to services.
It essentially is a database of all of our providers with an inventory of all the services that they offer.
Detox, withdrawal management, residential, outpatient, opioid treatment programs, DUI programs, whatever level of care the person needs or whatever resource they need, it can be found on this website.
The other thing that makes it stand out is it includes bed availability information.
Everything is located in one place. As easy as if you were to search Yelp for a restaurant, you could search for a provider.
All across the county, real-time information about services that we're offering to folks who are on Medi-Cal or Medi-Cal eligible.
The different filters really allow you to find a very specific facility that is going to assist you individually.
A pretty diverse range of services and languages that a user can filter through in order to get to the substance use treatment agency that they need and want. So if you're Spanish speaking, you can select the Spanish filter. That will actually then narrow the list of agencies that are able to provide bilingual services or Spanish speaking services for someone who needs that.
So it's really dynamic, it's functional, it's easy to access.
Our call center, which is open 24/7, 365, uses it for every single call.
When we go to it, we can see who's got detox beds, who has residential beds, who's opening their hand for us that day saying, give us a call because we can help someone.
We needed to ensure that it was updated on a regular basis. So we did build in contractual requirements for our contracted agencies.
We average about 93-95% accuracy with the residential updates to the SBAT tool.
We also developed a mobile-friendly version, recoverla.org.
So people can click on a button and access the entirety of our provider directory within a mobile app. We also added a backend dashboard
for us to better understand when are people actually looking for services so that we can, for example, staff our call center appropriately. Since its inception, it has 700,000 page views, and so it's used on a very regular basis.
89,000 users a year, and I would say we're seeing that in the fact that our overdose numbers, for the first time in a decade, have actually plateaued.
It's streamlining access to care for everyone that's able to use it.
If we can help one person, and then that person helps the next person, and that person helps the next person.
We are happy to help any county replicate this program. We have a good tool, and we'd like to help other people use this tool. The upfront investments that we already made in figuring out how to design this tool, the other counties don't really need to go through those early steps, and instead they're welcome to get technical assistance from us on how to make this tool work in their counties.
Recovery does work. If we could just give it to the person and give the person the chance, keep them motivated, keep hope alive.